All right, let's talk about something that's incredibly common but also notoriously painful: kidney stones. Today, we're going to follow the entire life story of one of these things, from how it's quietly born to the absolute mayhem it can cause when it decides to make a move. Let's jump right in. If you ask anyone who's actually had a kidney stone, they will tell you the pain is legendary, often described as being worse than childbirth or breaking a bone. So we're not just talking about some abstract medical condition. For millions of people, this is a seriously excruciating experience. So what's the official name for this whole ordeal? Urolithiasis. And yeah, we all say kidney stones, but that's really an umbrella term. A stone that's actually in the kidney is nephrolithiasis. If it's moved down into the tube called the ureter, it's ureter lithiasis. You can think of them as different members of the same, very, very unwelcome family. Okay, so here's our game plan. First, we'll look at the recipe for making a stone. Then we'll meet the different types, the rogues gallery, if you will. We'll get into what happens when one of them actually moves, how doctors find and fight them, and then we'll wrap up with the big takeaways.
So how in the world does this painful process even get started? What's the secret sauce for creating a kidney stone? Well, it actually boils down to a pretty simple concept: balance, or more accurately, a lack of it.
And this, right here, is the whole story in one simple equation. A stone forms when you have more stuff that can form crystals, the solute, than you have liquid to dissolve it in, the solvent. When the solute is greater than the solvent, you get a stone. It's as simple and as powerful as that.
Think about it like you're making iced tea. You can stir in a few spoons of sugar and it dissolves, no problem. But what happens if you keep adding more and more sugar? Or what if you let the tea sit out and some of the water evaporates? Eventually, you hit a point where the water just can't hold any more sugar. It's supersaturated, and you start seeing those sugar crystals pile up at the bottom. That is exactly what's happening inside your kidneys. And these are all the things that can tip that delicate balance. The biggest two, by far, are having too many of those crystal-forming substances and, you guessed it, just not drinking enough water. But other things can definitely set the stage, like your urine's pH level being too acidic or too alkaline, infections, and yep, sometimes it's just in your genes. Now, you might think a stone is just a stone, right? Wrong! They're not all created equal. They come in different chemical makeups, shapes, and sizes. And knowing which type you're dealing with is absolutely crucial because it tells you why it formed and how to stop it from happening again. So check this out. It's not even close. The undisputed champion of kidney stones is the calcium-based stone, making up a massive 70% of all cases. Way down in second place, you've got struvite stones, which are usually tied to infections. Then there are uric acid stones, often linked to things like gout, and then a few other rare types make up the rest. This little table is awesome for a side-by-side look. Calcium stones, too much calcium in the urine. Struvite stones are fascinating. They're created by specific kinds of bacteria. Uric acid stones, you guessed it, they form when your urine is too acidic. But look closely at that last column, because that is a total game changer when it comes to diagnosis. And here's why that last column matters so much. Some stones are radio-opaque, which is a fancy way of saying they show up bright and clear on a regular X-ray. That includes the most common ones, calcium and struvite stones. But uric acid stones, they're radiolucent. Basically, they're invisible to X-rays. That means doctors have to bring out other tools, like a CT scan, to even find them. Okay, now for the part of the story everyone knows and dreads. We've built the stone, we know what it's made of, but so far it's been silent. What happens when this little intruder decides it's time to move? And this is what's so sneaky about them. A stone can literally just sit inside your kidney for months or even years, slowly getting bigger, and you would have absolutely no idea it's there. No pain, no symptoms, nothing. And then one day, it moves. It gets knocked loose, and it falls out of the wide open space of the kidney and into the ureter, that super narrow muscular tube that leads down to the bladder. And that is when everything, and I mean everything, changes. This is the textbook description of what doctors call renal colic, and the pain is truly something else. It's not a dull ache. It's a sudden, sharp, cramping pain that grabs you in your side and back and can shoot all the way down into the groin. Your body is trying with all its might to force a sharp rock through a tiny tube. Yeah, the pain is so intense that your body's alarm systems just go haywire.
often causing nausea and vomiting. As that stone scrapes its way down, it can cause blood in the urine. And one of the classic signs is this intense restlessness. Patients literally can't sit still. They can't find any position that brings even a moment of relief.
Okay, so you're in the hospital. You're in agony. How do the doctors figure out what's really going on? And more importantly, how do they make it stop?
It's really like a full-on investigation. First, imaging is key. They need to see where the stone is and how big it is. A urine test can spot blood or telltale crystals. Blood tests can look for the underlying cause. But if they can actually catch the stone after you pass it, that is the holy grail. Analyzing it tells them exactly what it's made of, which is the key to preventing more in the future. For most small stones, the plan is pretty straightforward. Powerful pain meds and a whole lot of water to try and flush it out. If the stone is too big or just won't budge, they have other options. They can use a machine to blast it with high-energy sound waves from outside the body to break it up. Or they can go in with a tiny camera and scope to physically pull it out. Open surgery? Thankfully, that's pretty rare these days. So, once the stone is finally out and the crisis is over, you might think the story is done. But it's not quite finished. There are some potential consequences and a couple of really key facts to keep in mind. Yeah, leaving a stone that's causing a blockage is a big deal. In the short term, it can lead to a nasty infection or even cause your kidney to fail. And over the long haul, if you keep getting stones, it can lead to permanent scarring, chronic kidney disease, and might even slightly increase the risk for certain cancers of the urinary tract. But if there's one number I want you to walk away with, it's this one: 90%. That's the percentage of all kidney stones that are radio-opaque. And that is fantastic news from a diagnostic standpoint, because it means that for the vast majority of cases, a simple, quick X-ray is all it takes to spot the culprit. Which leads us to our last big thought. If 70% of stones are made of calcium, then the obvious answer is to stop eating calcium, right? Cut out milk, cheese, all that stuff. Well, it's not that simple. Actually, for a lot of people, eating a normal amount of calcium is protective. It binds with another chemical in your gut and prevents it from ever getting to your kidneys to form a stone in the first place. It's a perfect reminder that with kidney stones, the simple answer is often wrong, and it's all about understanding your own personal chemistry.